Hello, good morning, good afternoon, good evening, depending on when and where you're watching this video from. Is it okay to you read your own? There is something for us to learn today. That's why I'm here. The continuity of our lectures on causes of female and male infertility. Today we'll be discussing fallopian tube problems as a cause of female infertility. The fallopian tube is a tube that connects the ovary to the uterus, and there are two of them because there are two ovaries in a female. It's only a female that have gotten a fallopian tube, and there are two fallopian tubes in each female and two ovaries in each female. So these tubes connect the ovaries to the uterus. It's the passage where the semen fertilizes the egg of the woman, and then the embryo that is fertilized will now go to the uterus and be implanted. For women who have got fallopian tubes problem, their eggs are not able to be fertilized by the semen that the husband has produced because the way it would have passed has been blocked. What are the causes of fallopian tube blockade? One, recurrent sexually transmitted diseases like gonorrhea, chlamydia, as well as endometriosis, causing pelvic inflammatory diseases. It has also been seen that women who uses intrauterine contraceptive materials or contraceptive tools have been seen to have tubal blockade, especially when they have multiple sexual partners. This intrauterine contraceptive device have been seen to have caused tubal blockade. When the tube of a woman is blocked, like I told you, there are two tubes. If one is blocked, the other one can actually still be there for the woman to fulfill her reproductive cycles. But most times, what has caused the blockade of one must have caused the other one, diseased the other one. Either the other one has lost its cilia, because that tube has some microscopic, it's not to bother you with the words, it has something tiny that helps to sweep the egg and the semen to a place where they will meet and then they will be fertilized. But a diseased fallopian tube will not have this cilia, and so such people, it's either they have an ectopic pregnancy or they are not able to have their eggs fertilized. So it is seen that people who have one fallopian tube blockade, the other fallopian tube, because of the cause of the blockade of the other one, must have diseased this one that is not blocked. And so the fertility problems in such individuals will persist, as such individuals will require assistance to be able to conceive. So what am I saying? If one tube is blocked, the other one that is not blocked must have suffered the same fate with the other one, and so might not be able to achieve your aim to be able to get pregnant. So women who have bilateral tubal blockade, fallopian tube blockade, the help that you have for pregnancy is to do what they call IVF. IVF is when your own egg and your husband's sperm are fertilized outside your body. This is because the route to which they will get fertilized is being blocked. So after being fertilized, they will not implant, they will not bring the embryo and put it into the woman so that it can find the way and be implanted. So when it's implanted, then you finally get pregnant and then deliver at term. Don't be deceived. Although there are surgical procedures that they do when there is a tubal blockade, but the problem is that there will be a recurrent because the tube is a narrow one. It has an endometrium that is smooth, without infection, without injury. That endometrium is smooth in such a way that it will not allow itself to heal together, to cause obstruction or cause fibrosis. But when there is current infection, when there is injuries to these tubes, so they can heal because I told you it has a narrow lumen, they will heal together and cause obstruction. So any surgical procedure you tend to go there and do, immediately you do it, in another 1, 2, 3 weeks or a month or thereabout, it has healed together again. So because of the recurrence of tubal blockade following surgical procedure, the help that is long lasting is to help these two couples trusted to be pregnant get pregnant through IVF. IVF babies, they are still your babies. If DNA is done, it will still be the result because it is your egg and your husband's semen that is fertilized and put into the female. Except for people that are not ovulating, except for people that are not producing semen. That's another topic for another day. Hope you learned something. Don't kill yourself because your tubes are blocked. Explore the options that you have and be a happy mother. Bye.